My name is Dr. Nishant Yagnik. I'm head of neurosurgery at Manipal Hospital, Gurgaon. And today I'll be talking to you about one of our specialty procedures that we do here in the Gurgaon unit. And that is keyhole brain surgery for brain tumors. Now, many people believe that brain tumors is a death sentence. On the other hand, we are here to convince people, and we have, that not only is it not a death sentence, but also that it can be done fairly safely with as minimal a disruption in your life as possible. See, there was a time when we used to think of brain tumor surgery as, let's attempt to do it and see what can be achieved. Now we have a very fair predictor of what can be achieved based on the kind of tumor that we are dealing with, including tumors in very little children, including tumors in working adults, and including the most common group, which is the older age group that suffers from brain tumors. The approach has changed because of a change in technology that we now possess and that we have a very strong and adept utilization of. And this includes microscopy, endoscopy, and navigation, along with electrophysiological monitoring. With these tools, we not only can predict where exactly the tumor is, we can approach it and remove it with as minimal disruption, not just to your brain, but also to the hair on your head. In fact, we prefer to make sure that people undergoing brain tumor surgery do not feel the stigma of brain tumor surgery, and it can be a very strong stigma. Imagine a young person who has a brain tumor, who has to get back to normal life, goes to his or her office, has his head shaved, has a scar on the head, and suddenly the bosses label him or her as someone who is not dependable for no reason or no fault of their own. Someone who possibly won't get promoted, someone who won't be selected in sports, someone who will have social difficulties making friends. Well, we are here to combat that now with a very different mindset and thinking that has come up in the last 8 to 10 years in international neurosurgery. And this thinking is that when you come to us, we do minimal head shave, we do an exact prediction. We're using imaging, not only of the location, but of the structure and form of the brain tumor. Then we approach the tumor with small keyhole incisions, and then we use scopes to get into the tumor, causing minimal disruption to both the brain, the skull, the scalp, and the hair. The results of this not only help in helping people adjust with living a routine life, but also with the post-operative recovery, with lesser muscle dissection, lesser disruption of pain-producing factors, and lesser stay in the hospital. We can assure that the journey of the patient is as smooth as can be possibly done. Now, there are different types of brain tumors. Some tumors we can remove completely and we can have fair assurance that they won't come back. Some tumors we can only remove partially because they're in very deep locations of the brain. But even in those tumors, you'll be surprised how far we can take a patient by removing 90 to 95% of a tumor, then using radiation and chemotherapy to give a very good quality of life, with monitoring that if the tumor comes back, if it comes back, then we manage it again with full force. And in this particular approach, the redo approach that is required for many tumors, which are impossible to remove completely, this keyhole procedure does really well. Because see, if you disrupt a lot of structures in the brain to remove the tumor in the first go, then by the time it happens in the second go, you've already done a lot of peripheral collateral damage. With the keyhole approach, the second time that a patient requires surgery, which they do sometimes in brain tumors, there are the chances that we're going to disrupt things further increase, but now we have a lot of space and collateral to work with. That being said, there are a number of cases and testimonials on our Facebook website for our particular group that I have done, where patients have spoken about their brain tumor journey and other problems of the brain, such as brain aneurysms, spinal tumors, spine surgery, and complex brain anomalies, including children with complex anomalies and abnormalities of the brain that have spoken out or given support to us because of this novel and far-reaching approach. The best part is that this sort of technology usually costs a lot of money, but Manipal being a very scientific group, a teaching and educational group, we managed to do all of these techniques in a fairly affordable cost, so that surgery is available to almost everyone who has and suffers from these problems. And with this mindset, we have actually made significant strides ever since the hospital has begun in this area. So, God forbid you ever utilize my services for brain tumors, but if you do, then you can rest assured and be here with a promise that you will be given the best care possible in the least disruptive way possible to the patient's lifestyle, patient's costs, and patient's rehabilitation. Thank you.